Okay, so thank you everyone for joining us today for this Alumni Office Hour session, our last of the term. My name is Jen Bentley. I'm the Alumni Advancement Officer for the Faculty of Health. And in my role, I work to provide opportunities for alumni engagement, but also things like this where I get students the opportunity to connect with our alumni and learn from them as well. I'm going to start today just by acknowledging that much of the work of the University of Waterloo takes place on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Our main campus is situated on the Haldeman Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work toward reconciliation takes place across our campuses through research, learning, teaching, and community building, and is centralized within our Indigenous Relations Office if you're looking for more information on what we're doing on campus. So I'd like to welcome you all again to our Alumni Office Hour with Allie Piatkowski. Did I say that correctly? I realized I didn't ask you
that's
that.
okay. You're very
Pardon?
close.
Piatkowski, sorry.
Very close.
Yes, so now I've just lost my notes. Very excited to have Allie with us today, though. Bringing back alumni to connect with our students is an important priority for both the faculty and the broader university. It gives us a chance to showcase our alumni and for them to show students what's possible. The success that they've had and the stories they share help to shine a light on the path for students and who might be wondering what their own futures will look like. So if this is your first Alumni Office Hour session, we have been hosting these all term and then the fall term as well. And just so you know, we will continue to host these in the spring term and all year round moving forward. If you do have any requests for careers that you'd like to see or ideas of people that you think would be great to host one of these sessions, please feel free to share your ideas in the chat. I really want to bring students the people that they want to hear from. So any feedback that you have would be really great to help my planning. And then in order to make the most of this small group session and make it really friendly, it'd be great to have everyone turn on their cameras so that Allie gets to have a conversation with you and not just a blank screen. So anyone who's comfortable turning on your cameras, I'd encourage you to do that, especially when we get to the Q&A portion so that you can ask your questions face to face. Use the raise hand feature to ask your question. If you are somewhere like the library or where you can't come on live to ask your question, you can feel free to use the chat and we will address those questions as well. But as much as we can, we'd like to have a nice live conversation as a group. So I will just get into introducing Allie and then I will pass it over to her. So now I'm going to say it wrong again. Allie Piatkowski is a multidisciplinary healthcare leader experienced in project management, health systems improvement, public health and epidemiology, and knowledge translation and evaluation. An epidemiologist by training, she has always had a keen interest in improving population health and has diverse experience across the health system at federal, provincial, and local levels. She values meaningful engagement with diverse stakeholders to ensure that all voices are represented and to foster better integration across sectors. Using data and evidence to inform decision-making is also central to her work. In her current role as project manager of Geriatric Emergency Medicine at the University Health Network, she is working to build a more connected, equitable health system where older adults receive the care and support they need, where and when they need it. She holds a Master of Public Health in Epidemiology from the University of Toronto and a Bachelor of Science in Health Studies from the University of Waterloo. Thank you, Allie, for joining us, and I will let you tell everyone the story of your journey from Waterloo to where you are now.
Absolutely awesome. Thank you so much, Jen. Really appreciate the introduction. And thanks for joining everyone today. It's very nice to meet you all virtually. I'm excited to be here and to share my career journey and learnings with you. Honestly, I love connecting with Waterloo students and alumni. Had a great experience at Waterloo, and it's great to reminisce about those memories, but also just to connect with people, share some of my learnings, but also learn from you as well. I always find that I learn a lot from students and alumni too. So first, just a bit about me. I grew up in the Kitchener-Waterloo area, and I still consider it one of my homes. I now live in downtown Toronto with my fiance, Hank, and our cat, Bobby. I love going for long walks, exploring new places, trying new foods, watching hockey, DIY crafts, and spending time with my fiance, cat, and friends and family. I love to volunteer and stay involved in my community. And during non-COVID times, of course, I love to travel, and I'm looking forward to doing so again. So in terms of my journey to where I am today, for as long as I can remember, I've been interested in human health. I remember as a kid watching shows like Mystery Diagnosis and Dr. G Medical Examiner and being fascinated instead of grossed out. So I knew this was something I wanted to go into. But going into university, I knew I wanted to study health, but I didn't have a particular area that I wanted to specialize in. I was considering a career in medicine, but I didn't yet know about all the wide variety of options for careers in the health field. And honestly, I think this is a pretty common situation in the health studies program. But this is what led me to pursue it, because I really wanted to get that broad base of knowledge in health. I think many of us at that point are only aware of the well-known careers in the health field, which are typically the clinical health professions, which are obviously great options, but the program really exposes you to so many other options as well. So I absolutely love the program, and choosing that program was one of the best decisions I've ever made. My favorite aspect of it was how multidisciplinary it was. So I've always been someone with a wide variety of interests, and this definitely helped me to develop those interests. I really enjoyed being able to study a combination of biological sciences, human health, social sciences, the health system, determinants of health, and more. And the program really helped me to discover that my preference is to look at the big picture, and I really want to work to improve population health and population health equity at that level. So this is what led me to further my studies in public health and to pursue a career in epidemiology and health systems. It also really taught me that I'm interested in the intersection of public health approaches and the formal healthcare system, and how can we actually increase collaboration between different sectors, because unfortunately they often work in silos. Also talk a little bit about my experience with co-op, because that was also one of the best decisions I've ever made. Through the co-op program, I gained a wide variety of experience, from the front lines to project management and administration, to health regulation, to research and data analysis. So it helped me to begin to gain diverse experience across the health system at federal, provincial, and local levels. And this also helped me to realize that I enjoyed approaching health from a public health and health systems perspective, and that I wanted to further my studies and pursue a career in public health and epidemiology. So we'll talk a bit about my co-op experiences and some of my learnings from each. So it was a pretty wide range of roles, which I enjoyed. My first role was at L'Arche Canada in Richmond Hill as a residential assistant, building relationships with and helping to improve the quality of life for people with disabilities, as well as supporting their personal care and health needs. And I grew a lot in my interpersonal and leadership skills in this role, as well as getting a better understanding of all the gaps that unfortunately exist in our health and social systems, particularly for people with disabilities. My second position was at Trillium Health Partners in Mississauga, working in the medical affairs office and supporting a variety of projects that range from discharge summaries to software training to applications of physicians to the hospital. This was definitely a high intensity role that put me right into the weeds of healthcare administration, gave me experiences working in an office environment, and gave me my first taste of what project management involves. My next position was at Health Canada, working on reviewing natural health products for safety and efficacy and ensuring they were complying with regulations. It was great to get experience at the federal level, brush up on some of my French skills, and improve my communications and stakeholder engagement skills while working with companies who were applying for product and site licenses. And then my final position was an 8-month position at Cancer Care Ontario, where I worked as a research assistant, conducting the analysis and developing an interactive website for the Cancer System Quality Index, which is an annual report on the performance of the Ontario cancer system. I also supported the organization's strategic plan and planned an annual event on patient safety. So this was great to get experience at a different level of government, the provincial level, and to get an understanding of the Ontario cancer system, improve my research writing and data analysis skills, and make connections with lots of high-profile stakeholders. So a common theme I think you'll see throughout my co-op experiences is that while they definitely allowed me to develop and apply my technical skills and knowledge of health, they actually did a lot more to help me develop my soft skills, including leadership, interpersonal skills, and communication, which I think are much more difficult to teach in a classroom. They can really be grown through practical roles like this, and they can be applied to any role you'll take on in your career. So all these experiences helped me to further develop my interests and learn which type of roles I was more or less interested in pursuing in the future. I'm definitely glad I decided to pursue a wide variety of experiences because it gave me in-depth knowledge in a variety of different areas and about all of the different possibilities within the health and healthcare fields and how the system works as a whole. So my education and co-op experiences all culminated in me choosing to pursue my Master's of Public Health in epidemiology at the University of Toronto. I really wanted to further develop my knowledge of public health and epidemiology, which had been introduced to me in the health studies program. I was fascinated by data and better understanding population health and how we can improve it. I was also less interested in academic research, and I was looking for an applied practical program where I could gain skills to apply on the job. So this led me to choose the MPH EPI program at U of T, which is a course-based master's program that includes a practicum component, which is very similar to Waterloo's co-op program, which obviously I really enjoyed. So the program was very interesting, definitely challenging, but also rewarding. My favorite aspect of it was that many of the professors also held high-profile positions at different healthcare and public health organizations, along with their roles at the university. So they really brought their real-world learnings to the classroom. It always felt very realistic and not theoretical. I also really enjoyed the practicum component of the program, of course, because it was so hands-on. My first practicum was at Public Health Ontario as an epidemiology practicum student. And in that role, I led the analysis and development of the annual report on vaccine safety in Ontario. So I really got the chance to develop my technical epidemiology and data analysis skills, as well as research and writing skills in this role. It was also a really fascinating topic to work on, and probably even more timely now, as we know. My second role was at the eHealth Center of Excellence in Waterloo as an evaluation specialist. So this is an organization, if people haven't heard of it, that's in Waterloo. It works to improve access to health information across the health system, improve communication between providers, and ultimately improve patient experience and outcomes. So in this role, I learned a lot about program evaluation, got to work with stakeholders, across a wide variety of health sectors, and also really started to develop my project management skills by managing and supporting progressively larger projects. And I enjoyed this role so much that I was able to bridge it into a full-time role after I completed my master's, where I worked for 2 years. And that was great because I really got to keep developing my project management skills in that role, and start to manage portions of projects and larger projects. So that was kind of, I would say, my first taste of actual project management, which led me to believe that that was something I might be interested in pursuing in the future. As much as I enjoy this role, I was also looking for a role where I could more directly apply my epidemiology and public health skills. So then I moved on to a role as an epidemiologist at the Health Commons Solutions Lab, which is a health and social innovation startup that is hosted out of Sinai Health in Toronto. So in this role, my work focused on supporting health-related organizations with things like population health assessments and health system planning. And in this role, my work also grew to include a lot more project management work, which I was interested in. And this really reinforced that this was something I wanted to focus on in the future. And I began to take on more opportunities in that area, and particularly during COVID. It was interesting. About half my role at the organization was pre-pandemic, and then about half was during the pandemic. So definitely very different environments and work during those two different times. So really enjoyed that role too, and learned a lot from it, but decided to transition into a new role, which I started last May. So as Jen said, I'm now the project manager of Geriatric Emergency Medicine at the University Health Network. So UHN is a Toronto organization. It's basically a hospital healthcare system that contains Toronto General Hospital, Toronto Western Hospital, Toronto Rehab, Princess Margaret, and a bunch of other healthcare organizations, but those are the main ones. So it's a very large organization. So I wanted to gain more project management experience and progress into a leadership role while still applying my public health and epi skills. So the work I'm doing, the project I'm leading, is developing a geriatric emergency medicine program, which is the world's first in this area. And our goal is really to improve the way that we care for older people in the emergency department, but also beyond. And that's through improvements to space, care, community, and through research and education. So emergency departments, unfortunately, aren't a great place for anyone to be, but particularly for older adults. So we're trying to work to change this by creating an environment that's tailored to older people and their needs, and where healthcare professionals can really work together to provide great care to older adults. They can be supported by their caregivers and family members, have better outcomes, and live independently, or as independently as possible in the place of their choosing. Also developing a lot of connections with the community to support people in the community and hopefully keep the care out of the hospital wherever possible. So as the project manager, I'm responsible for the strategic planning and implementation of the initiative, stakeholder engagement, basically making sure everything's running smoothly and gets done. I'm really enjoying this work so far. I've been there for almost a year, and I'm really looking forward to seeing where it goes next. So now I just want to share a few high-level lessons in terms of what I've learned from my career so far and what I continue to learn. And I'm sure we'll talk a lot more about this in the Q&A, but just some high-level things that I wanted to share. So as you've probably noticed during my talk, I have a lot of different interests, and I like to jump around, honestly, to a lot of different types of roles and not necessarily stick to one defined career path. And I basically just wanted to share that that's okay, and there's nothing wrong with that. I think often society tells us, you know, you have to pick one narrow career path and stick with that and just follow that exact trajectory. But I don't think that's true. I think there's ways to combine lots of different areas of interest and lots of different skills. And lots of us have many interests, and you don't necessarily have one particular interest that you want to stick to. Some people do, and that's great, and they should definitely pursue that specific interest. But I think particularly in the health field, there's lots of room for people who are what I would call generalists. That's what I would kind of identify myself as. I like to dabble in lots of different areas and not necessarily just focus on one. And maybe at some point you'll develop a specific interest, but you don't have to rush or pressure yourself to do that. My next piece of advice would be to find a mentor or mentors. So this could be formal or informal. It's really valuable to learn from people who have been there and are currently where you want to be. Obviously, as we know, there's so many different platforms that can help you get started. There's LinkedIn, 10,000 Coffees, mentorship programs, networking events, and just don't be afraid to reach out to professors, colleagues, people in the industry that you're hoping to enter. You could have a casual conversation, but it also might develop into a long-term mentor relationship, which is great. And that's something that I'm learning too, you know, the importance of mentorship. As I talked about, I really enjoy mentoring others and building connections with them, but I've also noticed that that's not always something that I seek out enough for myself. So honestly, I am currently participating in a mentorship program where I'd be connected with someone who's a little bit further on in their career than I am. And I'm learning a lot from her, which is fantastic. Next, I would say be open to where your career path could take you. So it's great to have goals, but also just keep an open mind because you don't know what kind of opportunities might arise. So as I talked about, I originally planned to pursue medicine, but the health studies program really opened my eyes to all of the opportunities within the health field, and that I wanted to focus more on big picture work. Next, I would say balance your energy between hard and soft skill development. So hard skills are more easily taught, but it's your soft skills that really set you apart, including your leadership, work ethic, interpersonal relationship building, communication, and many others. And then finally, I would say learning is a process and you're never done. So really continue to seek out professional development opportunities and just learning for the sake of learning throughout your career and life. So I know it's tempting, maybe once you finish your undergraduate degree to want to take a break from those opportunities, which is totally fair. I needed to do that as well. But I think, you know, seeking out those opportunities for yourself, whether they're formal or informal, is really important. So right now, personally, I'm pursuing my project management certification, which is obviously extremely practical in relation to my current position and career path. And lots of organizations have supports for professional development. And I would honestly recommend seeking out organizations and asking them, you know, when you're in interviews and such, what kind of professional development opportunities they offer, because that's something that's really important for employees and for your own personal growth and development. So I know that's a lot of information coming at you at once, but that's what I wanted to share for now, and really looking forward to chatting with anyone and answering questions.
That was so great, Allie. Thank you for all of that. And it's just always so interesting to hear kind of how co-op placements are such a big part of people's experiences and all of the different jobs that you've had since then. And yeah, it's really cool. And thank you for sharing all of those tips up front. That was great. But moving into Q&A, there's a good group of us online here. So hopefully we have some people with some questions for you. So feel free to use the reactions in Zoom to raise your hand, or you can put a question in the chat, whichever you prefer. And anyone who wants to turn on their cameras to ask the questions, I'd encourage you to do that as well. So trying to fill space, waiting for someone to raise their hand, but maybe I should start with one. So we had some questions submitted in the registration. And one of the questions was, what is your advice for an individual interested in pursuing a career in geriatric medicine?
Yeah, that's a great question. First, I would say that I think there's many different opportunities in geriatrics just because of our aging population. It's one of the biggest priorities for our health system, addressing the needs of older adults, which are an ever-growing population. So I think whether or not you're in a geriatric specific role, you need to be considering the needs of older adults and how our health system can better serve them. You know, there's tons of different roles in this area. I mean, obviously, Waterloo Health Studies has a great geriatrics specialization, and you know, many profs who specialize in that area. So I would recommend maybe chatting with them if that's something that you're particularly interested in. I think policy development is an important area of geriatrics and supporting the needs of older adults. So, you know, senior friendly policies and things like that. Working with organizations to help them to be more senior friendly. So there's a big movement, particularly within hospitals, to make them be senior friendly organizations. So through the spaces that they provide for people, the education and training for the staff, doing research in these areas, having staff who are really specialized in that area. So, you know, taking a big picture view at an organizational level and trying to make it a senior friendly organization. So yeah, I would just say there's a lot of leadership opportunities in that area. And obviously, if you're more clinically inclined, there's many opportunities in that area. Geriatricians. I work in my role with a lot of geriatric emergency management or GEM nurses who are really nurse practitioners who are specialized in caring for older adults in the ED, and they do incredible work. They do, you know, typical frontline nursing work, but they do a lot of case management. And I would say in some ways their role is kind of similar to a social worker, because they really try to take a big picture look at the needs of the older adult and how they can, you know, work with their family and obviously the individual themselves and any caregivers to help them achieve the outcomes that they want to achieve and connect them to supports in the community that would be helpful.
Great, thank you. Now the questions are rolling in. So
Awesome.
I'm going to try to go in order that they've been submitted. So if I don't go to you, it's just because I'm trying to keep track of that. And we'll start with, there were two in the chat first. So sorry if I'm pronouncing this incorrectly, but Rida asked, what advice would you have for someone who didn't do co-op to get relevant public health experience?
Yeah, I mean, I would say if you have availability during the summers of your undergraduate degree, to try to use that time to also do or undertake experiences that might be similar to what a co-op placement might look like. So there are many different summer student experiences, I would say, particularly with the government organizations like Health Canada and the Ministry of Health for Ontario. So they almost always hire summer students. So those are organizations and roles that you can seek out. I would also say maybe talk to your professors, see if there are opportunities for research assistant work. Obviously at Waterloo, there's many public health associated professors. So they might have public health relevant research that you could do if that's something that you're interested in. And And then if you're maybe beyond being a student, I'm sorry, I don't know necessarily who's a student or who's an alumni. But I would say, just reaching out to organizations to see if they're hiring, or if they would be interested in hiring, someone with a background in health who's maybe looking to develop their public health skills further. Even if you don't necessarily have direct experience in public health, I think there are a lot of ways that you can sell your knowledge of that area through the academic studies that you've done, or other transferable skills from other jobs, just to get a foot in the door. Or you might look at maybe non-public health specific roles at public health organizations. So maybe something like, let's say, a communication specialist at a public health unit, or a public health agency that doesn't necessarily involve as much of a public health background, but can help you get into an organization like that, where you might be able to move into a more public health related role in the future.
Awesome. Great recommendations. Hopefully that helped. I'd really like to also encourage, I see a lot of people putting questions in the chat. I'd encourage you, if you can, to just turn your camera on and like be able to talk to Allie when we answer these questions, and introduce yourself as well, so that she knows if you're a student or alumni when she's answering some of these questions. So I will go to the next person. I'll give you a chance to say if you'd like to come on video. So next we have Yuruj had a question. Did you want to come on and ask your question to Allie?
Hi, yes, just give me a second. I'm going to turn my video on. Hi, Allie. So my question was that I'm about to graduate from a Master's of Science in Public Health and Health Systems at Waterloo. And I do want to move on to a project management role in the future. I was just wondering if there are any steps I can take right now to work my way up to that kind of role in the future.
Yeah, for sure. Nice to meet you, Aruj, and thanks for the question. I would say a good place to start would be to take some sort of a course in project management, or start developing your knowledge on your own. I believe that Waterloo has some courses in foundations in project management. I personally, after I finished my master's at U of T, I took a foundations in project management course through the continuing education studies there. So that was really great, just to get some of the basic terminology in project management down, and what are the typical phases of a project, what goes into a project management plan, so you can really start to speak the language. But there's also so many free resources online too, YouTube videos, tutorials, just articles explaining just different tips for project management that I would definitely recommend looking into. If you're working in any particular role, or with any of your roles in the future, I would recommend starting to try to take on project management related roles. And it doesn't necessarily have to be as the actual project manager, but even seeing if there's a portion of a project that you could take the lead on. For example, early on when I started to do some project management work, I started by managing the evaluation portion of a project and really taking the lead on that. So maybe there's a portion of the project that you can really tailor your skills to and apply your skills to. And then that can potentially lead to, managing larger portions of a project, or managing a whole project in the future once you've gotten that experience. And then I would also say, and this doesn't have to be right away, but in the long term, if project management is something you're really interested in, I would recommend considering pursuing a certification. So the project management professional, or PMP certification, is definitely the most recognized. It involves taking a course in project management, some project management experience, as well as writing an exam. So it does take some time to pursue, and it might be a bit more of a long-term goal, but it really is well recognized and something that can help with getting jobs in the area.
Great, thanks so much. I posted another question in the chat. I don't know if it's okay to ask now or later, but I just wanted to ask, like, what's the best part of your job as a project manager at UHN?
Yeah, great question. So many different things. A lot of my work is very strategic and planning oriented, which I really love doing that type of work. But then I also really like seeing the tangible impacts of my work. So a small thing recently that I've done that has honestly probably been one of the favorite things I've done so far in the job is to develop what we're calling geriatric carts for the emergency departments at UHN. So they are carts that roll around the department, and they contain things like blankets and tablets and earplugs and headphones and dolls and blankets and games, coloring books, activity sheets, all these different types of things. So promoting comfort, communication, and reducing boredom for older adults in the ED. And we just implement those recently, but we've already heard some really positive feedback about them, and they seem to really be making a difference for people. Like, I've heard stories about 100-year-olds who are having a great time with the puzzle, and they obviously are typically going through a pretty challenging experience when they're in the emergency department, but hopefully that makes their lives a little bit better. So that's been one of my favorite things, is to actually hear the stories of how the work that we're doing is improving people's lives.
Thank you so much for all that. That was really helpful.
You're welcome.
Awesome. Thank you. Alex, you were next in the order for your question.
Sorry. Yeah. My name's actually Shani. Just logged in under my husband's name.
Sorry.
I only realized it when I joined, but so hi, my name is Shani, and I'm just finishing up my Master of Health Informatics, and it's just very interesting to hear your story, Allie, about your journey. And I think that co-op has definitely been something that has been very impactful for, both the hard and soft skills. And so where my interest is, that I feel that I'm very interested in, the projects that you're getting involved with UHN. I've heard about UHN. I didn't realize they were that big. It was interesting. I thought they were only 3 hospitals. But just finding, I think in the Master of Health Informatics, the one thing that I took that was very interesting, and the reason that I'm in the field, is to find those gaps in healthcare, and that make that impact that you can go about finding improvements and implementing them. And recently in my internship, I got a lot of technical interest in data and analytics. And I know you have a breadth of experience from your different experiences from different jobs of just being exposed to something like that. So I'm just wondering, when you mentioned about strategic planning and all of that, those sort of initiatives that are being taken place to improve the delivery of healthcare for patients, what is the process that you find that is generally used? What do you assess for? What data are you doing, using electronic health record data, or using a bit of survey data? How does that work? And then go from there to collaborate with teams and just bring those thoughts into fruition.
I just want to make sure I'm understanding your question correctly, Shani. Are you talking about how priorities are identified for strategic initiatives through data, or how is data incorporated into the planning for strategic initiatives?
Yeah, I guess I'm just asking for a general vision of how it works in the hospital systems. Do you for example, like what, yeah, so for example, the data types that you would be collecting, like what kind of an analytics that are being involved, and like is it within like a specific team, or is there, it's like kind of a network of questions, but
Yeah.
I guess just like a little bit more of like a context to like how you do what you do versus like the what of it, because the what is very interesting.
Yeah.
Yeah.
Yeah, no, great questions. And I can really only speak to my specific experience on my project. It's quite a large project, as I'm sure you can tell, but it is the main one that I'm focused on. And I'm still learning a lot myself, being fairly new to the hospital setting and almost being there for a year, but still feeling fairly new. But I definitely haven't learned a lot about that. So I mean, for this particular project, we use all sorts of different types of data. I mean, definitely a lot of quantitative health records data. There is a whole healthcare analytics team who really manages that. They're currently going through a big transformation through getting the EPIC electronic medical record within the hospital. So a lot of things are unfortunately done on paper right now, which is not a good way to go. And the tracking of a lot of people's healthcare information is not done very well. And then obviously it also makes things like quality improvement and research very difficult when the data just isn't available or isn't available in an easily accessible way. But we work with a really great analyst who basically gets us all the data that we need from the health records. And we use that data particularly to better understand the population that we're working with and that we're serving and what their needs are. Also for building the space that I mentioned, the geriatric focus emergency department, understanding, you know, how many older adults visit UHN each year, what kind of health conditions do they have, how long do they stay, how many beds do we need to build in this new unit, how big does it need to be, what are all the different types of rooms that it needs to have, etc. So that's one of the types. Also really looking at qualitative data too, so partnering with patients, families, and caregivers and trying to incorporate their perspectives. That's really important. And also looking at the experience of staff too, because we're hoping that this will help to make staff's lives easier and improve their experiences too. So looking at the patient, the population, and the staff.
Yeah, thank you so much. That's very good insight.
Okay, I'm moving back over to the chat, but is it Kieran?
Yeah.
I see your question next and you're ready to go, so you can go ahead and ask.
Hi, Allie. I'm currently doing my MSc in Public Health and Health Systems at the university, and I'm debating doing a PhD. And so I was wondering what you kind of found in differences of job opportunities with a master's compared to what you could do with a PhD, or if there's any at all.
Awesome. Nice to meet you. Yeah, I mean, I think that's great that you're thinking about that. I guess from my personal experience, doing a PhD wasn't something that I was interested in. I just wasn't really interested in academic research. And as I said, I didn't really have a particular interest that I thought I would want to focus on for 4 years. But I think if that's something that you want to do, that's great. I would say generally PhD related positions focus more on academia and those types of positions, but that's not to say that you can't get a role within the field as well. I mean, I definitely know a lot of PhD researchers working at public health or healthcare organizations, hospitals, like postdoctoral fellows and things like that. So I'd say probably the PhD just prepares you more for academic work, but it can also prepare you for jobs in the field, whereas at least a course-based master's degree like I did, and I'm not sure if yours is course-based or research-based, but that typically is a little bit more like industry and practical focused.
Perfect. Thanks so much.
No problem.
Okay, the next question in the chat was from Salva. Not sure if do you want to ask your question? And then Rupi will go to you next.
Yeah, sure. So thank you. So hi, Allie. My
Hey.
name is Alva. I'm a second year student in the health studies program. So I wanted to know what inspired you to pursue a master's in public health? And was this something you knew you wanted to do early on in your undergrad?
Hi, Salva. So nice to meet you. Great question. What inspired me, I think, was just my general frame of mind when it comes to health, and really through the health studies program, reinforcing the fact that I'm a very big picture person, and that's the level that I wanted to focus at, and really getting that intro to public health within the degree and within my co-op experiences as well. So I would say it was quite early that I decided that that was at least a direction that I wanted to go into. I'm not sure exactly when I decided that I wanted to do the Master's of Public Health specifically, but I think it was quite early on, like in one of our introductory to health courses, and when we were learning about the social determinants of health, it just struck me like how much sense that made to look at the determinants of health and understand health from that lens, and not just take a downstream approach, but also actually understand what makes people healthy and how we can actually help people to be healthier. So that was pretty early on that I decided that I wanted to take that general direction.
Okay, thank you. I also did have another question. Is it okay if I ask it? Yeah, so funnily enough, I think I'm in the same co-op position that you had at Health Canada.
Cool.
Because
The
it would be
product
an MHP.
license submission coordinator.
Well, it's not the same thing, but I think it's the same directorate, is it?
Oh, okay.
Yeah,
NHPD.
so, yeah.
Okay,
So
awesome.
what I was wondering was, through that job, what skills do you feel you gained that helped you throughout your other co-op positions or your position right now?
Yeah, good question. I think probably the top one would be communication. Just getting a lot more comfortable talking with people, talking with high-level people at different companies over the phone, via email. I think probably translated to some of my project management and organizational skills as well, making sure that the applications for the licenses were progressing as fast as possible, and keeping on top of all of them. And then also just learning a lot about the government and the system and how everything worked. As I'm sure you've learned, Health Canada is a huge organization, so many different departments, very complicated, but just getting a better understanding of that, and like what the role of that organization is, and all of the different organizations in the system was really helpful. I'd be interested to hear what you feel you're learning too.
Yeah, I would say I'm learning like a lot of different things, and it's like in my role specifically, I'm doing a variety of things. So I'm supporting like team members, but I'm also helping like writing proposals and communicating with other teams. So I'd also feel that the skills that I gain is like something that could be applied to many different jobs outside of the federal government and even outside of healthcare. So I think it's pretty great.
That's really great to hear.
Thank you.
Okay, Rupi, thank you for your patience. You can go ahead.
Hi, I am an MPH student at the University of Waterloo, almost done my program as well. I was curious what you thought about the Doctor of Public Health program that U of T recently introduced. I think it's only in its second or third cohort. It's quite new. And it is more geared towards being practice oriented rather than research oriented. So rather than PhD, it's more research oriented. And I'm curious about it and the kind of what the field, what kind of impact it will have, but I would like to hear your thoughts as well.
Yeah, great. Nice to meet you, Ruby. Honestly, I think it's a very interesting program. As I'm sure you know, it's the first one in Canada. It's typically much more of an American-based program. So I think it's pretty exciting that they've introduced it here. It's something that I've taken a bit of a look into myself to consider if it might be something I would be interested in the future. As I mentioned, I am a little bit more practice focused than academic research focused. So if I was to do additional schooling and something like a PhD, that's probably a program that I would be more interested in. I mean, one thing I'll say is it is quite expensive, of course. So that is one factor. But in terms of the content of it, I mean, I think it seems extremely interesting and practical and really like applying the real world experience that you've already gained to the program versus developing knowledge that you would then apply to the real world. I mean, obviously you'll be developing additional knowledge in the program too, but it seems to be very integrated with what people's previous experiences are, the work they're currently doing, and the work that they hope to do in the future. So in that way, it sounds very interesting, but I think I'll, just like you, I'll keep tabs on how it's going. I'll let you know if I can get connected to anyone who's actually taking the program, because I think that's probably the best way to find out more about it, and people's experiences is actually talking to them. But would love to hear your thoughts too.
Pretty similar to what you're saying. Yeah, I'm just hoping that someone from the first or second cohort, someone who's just going through it now, will speak to us, or if I'll be able to join a talk that they're giving and learn from them.
Yeah, that would be great. I would tune into
that. Should we look for some alumni who might be in that program? Is that what you were saying?
Oh, I mean, that would be great, but I don't, yeah, if there are any U Waterloo alumni who are in that program and would like to do a talk, that would be awesome. Much appreciated.
Okay.
But,
maybe I can try to do a little bit of digging and see if I can find anyone.
Okay, thank you.
Find out. And Allie, if you find out of anybody that you know, let me know.
Yeah, definitely.
Great. Okay. Emily has a question, and then we will go to Dasha after that. Oh, Emily, I'm not sure if we're getting your sound.
She says she's not sure if her mic works.
Oh, yeah. You want to put it in the chat? I can read it out for you. Sure, I will go to Dasha and then you can put your question in. Dasha, go ahead.
I guess I just wanted to, okay, let me introduce myself, sorry. Hi, I'm Dasha. I'm currently in my second year of the public health program at the University of Waterloo. I guess I just wanted to say that I was really glad to hear you mention that it's okay to have like several different interests and to explore those interests further. I feel like I'm kind of in that same boat. I have several things that I'm interested in, and I wasn't really sure on which path I should choose. So I was happy to hear that it's okay to explore those interests and try different things, and I don't have to just stick to one route. I also wanted to mention that I'm currently on a co-op term. I'm working as the social media assistant for the School of Public Health. So I was just wondering if those of you that are comfortable, if it would be okay for me to take a screenshot with your cameras off, so I can just create a short tweet about this event.
Yeah, so we've been doing this for all of our events, just taking a quick screenshot. So anyone who's comfortable turning their camera on just for a minute for a quick photo that Dasha can put on Twitter, that would be really great. So we'll give everybody a second who don't mind being in a photo to turn on their cameras if there are a few more people.
Yeah, thanks, Dasha. Nice to meet you, and that's great. Good to spread the word.
Yeah. Okay.
Okay, I'm gonna do a countdown. 3, 2, 1. And I'll take one more. 3, 2, 1. Thank you so much.
Wonderful.
Yeah.
Thanks. Just want to check in with Emily if you still want to ask your question. Let us know. Okay, here it is in the chat. So she says, I'm currently in my first year public health and there's no foundational science courses. I was wondering with an MPH in epidemiology, how much foundational science is needed?
Yeah, good question. Thanks, Emily. I would say that actually no foundational science is absolutely necessary for the MPH and EPI program. It definitely helps to have that background knowledge. But I would say what's more important than the core science knowledge is just knowledge of health and the healthcare system, and having that foundational public health knowledge from the public health program, I think would be really helpful. But it's a lot more focused on that rather than the core sciences. And I do know people who came into the program that didn't have a science or a health sciences background.
So if I think we have time for one more question, if anyone has anything else they'd like to ask of Allie. We've had great conversation today though, and great questions.
Mm-hmm.
So happy to have all of you here getting this insight from Allie and helping you figure out your career planning and what's next for you. So I'm not seeing anything else coming in, so I will just wrap up with a few notes. I did want to mention I put a link to Waterloo's professional development courses in the chat. So there are project management courses in there. I'm not 100% sure what fees students pay for those courses, but as alumni, you do get a 20% discount on those as well. So definitely good to look into. But also wanted to thank Allie, obviously, for her time being here with us today. Allie, if you're open to sharing your contact information or just your LinkedIn with the group, that would be great. Oh, look, you
Yeah,
just
for
put
sure.
it
I
in the
actually
chat.
just did.
You were just reading my mind as I was speaking.
I'm really happy to connect with anyone who's interested afterwards, and I appreciate the chance to meet everyone.
That's wonderful. Thank you so much for doing that. It was so great having you. Also, everyone who's here, you will get an email survey, just a really short, like probably takes 30 seconds to fill in the survey about today's session. You can pick your smiley face rating. It's really quick, so we'd appreciate any feedback you have on that. So if you could do that when you get the email, that'd be great. But otherwise, this was our last office hour for this term. You can watch for them to come back again starting in May. And again, if you have any suggestions or people you'd like to hear from, you can put it in the chat. You can send me an email. Just let me know, because I'm here to put these sessions together for you. So thank you all for joining us tonight. And Allie, thanks so much for being a great resource and staying connected as an alumnus. So.
You are so welcome. Thanks, everyone.
Awesome. Well, everybody have a great evening. Lots of thank yous in the chat. And Allie, don't go anywhere just yet.
Okay.